In a bold statement that has sparked intense debate, Labour peer and Dr. Lord Philip Hunt has suggested that the NHS might need to move towards an insurance-based funding model to secure its long-term sustainability. This controversial proposal comes amid growing concerns over the NHS's ability to meet the increasing demands of an aging population and the rising costs of healthcare.
Have you ever wondered how some people make money from home? With a simple method, you can transform your financial situation. Learn more in the link in the description. Don't miss this opportunity.
The current funding model and its challenges. The NHS currently operates on a general taxation model, where funding is allocated from the government's budget. However, as the population grows and life expectancy increases, the strain on the system has become more apparent. Lord Hunt argues that the current model may not be sufficient to meet the future needs of the healthcare system, with an estimated funding gap of £30 billion by 2033-34. The challenges facing the NHS are multifaceted, ranging from staff shortages and increased demand for services to the rising costs of new treatments and technologies. As the system struggles to keep up with these pressures, the quality of care and waiting times have become major concerns for patients and healthcare professionals alike. Exploring alternative funding options. Lord Hunt's suggestion of an insurance-based scheme is not a new concept. Many European countries, such as France and Germany, have successfully implemented social health insurance (SHI) systems. These models require individuals to contribute to a fund that covers the cost of healthcare, often through payroll taxes or mandatory premiums. The advantage of this approach is that it provides a more stable and reliable source of funding, reducing the reliance on government budgets. However, the transition to an insurance-based system would not be without its challenges. It would require a significant overhaul of the current funding structure and could potentially lead to increased costs for individuals. There are also concerns that such a system could limit access to health care for those who cannot afford the premiums, potentially exacerbating existing inequalities in the system. Potential benefits and drawbacks. Proponents of an insurance-based system argue that it could provide a more sustainable funding model for the NHS, allowing for long-term planning and investment in healthcare infrastructure. It could also encourage individuals to take a more active role in their healthcare decisions, potentially leading to better health outcomes and reduced strain on the system. Critics, on the other hand, argue that an insurance-based system could undermine the core principles of the NHS, such as universal access and free healthcare at the point of delivery. They also point to the potential for increased bureaucracy and administrative costs associated with managing multiple insurance funds. The need for comprehensive reform. Lord Hunt's comments highlight the need for a comprehensive review of the NHS's funding model. As the healthcare landscape continues to evolve, it is crucial that policymakers explore all options to ensure the long-term sustainability of the NHS. This may involve a combination of increased funding, improved efficiency, and innovative approaches to healthcare delivery. One potential solution could be a hybrid model that combines elements of the current taxation system with an insurance-based approach. This could involve mandatory contributions from individuals and employers, while maintaining the principle of universal access and free healthcare at the point of delivery.
Did you know you can start making money from home without big investments? This opportunity is changing lives. Find out more in the link in the description and start today. Don't miss out.
The future of the NHS is a critical issue that affects everyone in the UK. As we navigate these challenging times, it is essential that we engage in open and honest discussions about the best ways to secure the future of our healthcare system. Whether through an insurance-based model or other innovative approaches, it is clear that bold action is needed to ensure that the NHS remains a source of pride and a beacon of excellence for generations to come. For more updates on the future of the NHS and healthcare policy, be sure to subscribe and stay informed. The decisions we make today will have a lasting impact on the health and well-being of our communities, and it is our collective responsibility to ensure that the NHS remains a world-class healthcare system for years to come.